Ethics in the treatment of individuals struggling with substance use disorder is very important because you're catching people at a very vulnerable time in their lives.
There's such a high unmet need because there's such a stigma with mental health in general, but also substance use disorder.
Quality, evidence-based care is critical in addressing the overdose crisis. Unfortunately, not all treatment is ethical or quality, and that impacts people that are struggling with this disease.
I am a big proponent of the ethics in treatment. Treatment is very important to me. I've been in recovery for 40 years, and if I did not receive the proper treatment, I probably would not be here today.
If addiction and the opportunity for recovery is not talked about, the problem will persist. And so the Center for Addiction and Recovery Education is about leading the conversation.
So it really provides a great opportunity to bring greater awareness and education and really help ultimately the students and the community.
Making sure that all the treatment centers and treatment providers are acting under good ethical standards is really important.
I think St. Joe's hosting this event today really shows the progression in getting rid of the stigma of addiction, as well as what recovery can look like to individuals of all ages. And I think hosting it at St. Joe's really shows their desire to want to be a part of that.
I think it's a significant opportunity for us to host the event, to be able to bring together those different factions dealing with substance abuse disorder.
I think the Center for Addiction and Recovery here is a wonderful idea. They're really good people and have some really good ideas, and so I think this is a wonderful center, and I'm really fortunate to be here to meet some of those individuals today.
The Center for Addiction and Recovery is an important resource, not just for St. Joe's, but for our Commonwealth, because what we're able to do here is we're bringing together important people on these kinds of topics so they can generate discussion and change minds. Because the reality is that addiction is a common condition in Pennsylvania. 1 in 3 families suffer from addiction, and we need to make sure that it's okay to talk about it. People need to know where their care is and how to access it so that we can save lives.
I think St. Joe's hosting this event today on ethics in the treatment of substance use disorder is right on target for a Jesuit institution. One of the things that I've always admired about the Jesuits is how they really reach out to people on the margins. And I think that, the opioid crisis and other substance use disorder, issues that we face really do impact people on the margins. And I'm really proud of the university for taking this question head on.
We all know that addiction is so prevalent throughout the world, really, in the country, and for St. Joe's as a Jesuit university to be involved in this space makes all the sense in the world.
This is a disease that is inculcated in society, and that everybody's been affected by it. And higher ed should be at the leading edge of studying acute problems like this. And it's wonderful to see that St. Joe's is really one of the leading institutions now in a short period of time of not only creating a great dialogue about this topic, but also, according to our Jesuit ethos, real solutions, taking action.
St. Joe's Center for Addiction Recovery is actually the spearhead for a movement that I hope will become a national movement.
I'm excited for the future. I think they're kind of just getting warmed up.
To me, it's like coming home, and I'm really grateful that St. Joe's comes through again to present an issue important to our community.
I think the Center for Addiction and Recovery Education fits in really well with the Jesuit principles and the mission of the university, which is to help people at the margin, to help those less fortunate than us, and to address social justice issues in a scholarly and compassionate way. And for that, I'm really proud of my school.